the flu can really take you down. The symptoms can be very severe. So we're going to talk about that, the symptoms, how to know if you might have it, but also prevention, because there are a lot of things we can do to prevent it, and of course, treatment as well. So let's jump into the symptoms first of all. Some common symptoms include things like fevers and chills, but some of the hallmarks are things like body aches and muscle aches and the fatigue that can come along with it. I mean, you can just be downright exhausted with the flu. Not only that, but you can get a sore throat, you can get nasal congestion, runny nose, things like that. Some people get headache as well. I mean, that's something I've typically gotten when I've gotten the flu. And also some people get nausea and vomiting, although not everyone does. And the thing about the flu is that it can last a little while. I mean, you can actually feel sick for some days. And hence when I say you feel like you've been hit by a bus, sometimes that's how people feel. But the good thing is there are a lot of things that we can do to prevent it. Oh, and let me just jump right back. You might be saying, well, how would I know that I don't have COVID? That's a great question, because truth be told, in this day and age that we're living, it can actually be hard to tell by symptoms alone. So if you have symptoms, you need to talk to your healthcare provider. Consider getting tested for COVID in addition to flu. Make sure you run it by somebody to see what exactly you need to be doing. But keep that in mind, because flu symptoms and COVID symptoms really can overlap, okay? Okay, let's talk very briefly about treatment though, guys, because this is really important. I think a lot of people don't know that there are actually treatments for the flu. And first of all, preventing the flu with the vaccine and our hand hygiene measures and things like this, and getting prompt treatment is actually very important. Because the flu can actually be very serious. Every year, a certain number of people actually get very severely ill or end up hospitalized, and even some die from complications of the flu. When it comes to treatments, yes, we want you to do your fluids and rest and all that kind of stuff, Tylenol, Motrin, things like that, if your doctor says it's okay. But remember, we have antiviral medications that could help shorten the duration of your flu symptoms or make your symptoms milder. Win-win, win-win-win, right? So what that means is if you think you have the flu or if you know you have the flu, make sure you're talking to your doctor or a healthcare provider to see if you qualify for one of these antivirals to help you get back up and going and feeling better a lot sooner than later. All right, let's talk about prevention. Probably one of the best and greatest preventative strategies we have is the flu vaccine. That's right, we got the flu shot. And guys, it works pretty darn well. And it's awesome because in many cases it prevents us from feeling like we've gotten hit by a bus should we get the flu, which of course it prevents. Couple of myths I want to bust. A lot of people say the flu shot gives you the flu and things like that. It does not. Flu shot's not going to make you sick. It's not going to put toxins in your body or poisons or things like that. There are a lot of myths running around about the flu shot. Guys, it really is our best preventative strategy against the flu. So if you have not gotten your flu shot yet, please, don't walk, but run out there and get the flu shot. That's so important. It's quick and easy to do. Make sure that you're getting that. But some other preventative tips that we have to keep in mind, okay? Make sure that if you sneeze or cough in general, that you're covering your sneeze and cough and not with your bare hand, okay? Make sure you're coughing or sneezing into your elbow so that all of the stuff doesn't fly all over the place and you don't get it on your hand and transmit it. Or cough and sneeze into a tissue that you can promptly throw away. Other things is make sure you're washing your hands plenty of times, guys. This is so important. And then also cleaning and disinfecting the space that you live in and things like that. And also something I like to do is if I'm using public restrooms or things like that, trying to avoid touching things, right? So if you can grab the paper towel that you dried your hands with after washing and you use that paper towel to open the door and then throw it out, that might help you as well. Also, you can use an alcohol-based hand sanitizer if you don't have access to soap and water at the time. That can be very helpful as well. And then the other thing too, we always think about with upper respiratory viruses and conditions like the flu is just try to avoid touching your nose, your mouth, your eyes, because that's often the way that germs get in our system, okay? Oh, and by the way, if you get sick with the flu or anything else, stay home. That is right. Don't go to work. Don't go to school. Don't expose other people. But please get your flu shot if you have not already. So a lot of good options here, guys. The most important thing is to keep healthy, stay healthy. When we have the flu, we are missing work, we are missing school, we are missing a whole lot of life, and we certainly don't want to do that. Guys, make sure you get your flu shots. You talk to your doctor if you have any questions. I'm Dr. Jen Caudle. It's great to see you guys. I hope you stay safe this season. For those of you who are new to me, I do daily health videos and all sorts of stuff. Make sure you subscribe to my channel and click the little bell for updates. Guys, stay healthy and take good care.